Hello boys and girls, nice to see you again. Today we will be talking about pediatric cardiac defects.
The UT College of Nursing proudly presents
Where's the Defect?
Atrial septal defect is an opening between the left and right atria. This allows for both oxygenated and unoxygenated blood to mix. Blood from the higher pressure left atrium flows into the lower pressure right atrium, as seen here by the colored dots. Red dots represent oxygenated blood, and the blue dots represent unoxygenated blood. Presentation of this disorder can be asymptomatic, but can lead to such complications as congenital heart failure, murmurs, atrial dysrhythmias, and pulmonary emboli.
Ventricular septal defect is an opening between the left and right ventricles. This allows for both oxygenated and unoxygenated blood to mix. Blood from the higher pressure left ventricle flows into the lower pressure right ventricle, as seen by the colored dots. This disorder places the patient at risk for congenital heart failure, murmur, and bacterial endocarditis. Both septal defects can be fixed by a Dacron patch being placed over the opening if it does not close on its own.
Oh, good as new! Transposition of the greater vessels is a condition in which the pulmonary artery and aorta are switched. In a normal heart, the pulmonary artery exits from the right ventricle and the aorta exits from the left ventricle. As illustrated clearly in this depiction, unoxygenated blood now flows to the rest of the body, and oxygenated blood is pumped to the lungs. This condition is often accompanied by a septal defect, which promotes a minimal amount of oxygenated blood to be pumped throughout the body. Because of this inefficient oxygen supply systemically, the patient will show excessive cyanosis. Arterial switch surgery is required to return the vessels to their appropriate spots within the first weeks of life, as this condition is fatal if left untreated.
Tetralogy of Fallot is a condition in which the heart has 4 defects. These defects include ventricular septal defect, pulmonic stenosis, overriding aorta, and right ventricular hypertrophy. Blood flow between ventricles is dependent on pulmonary and systemic resistance to flow. If the pulmonary resistance is higher than the systemic, the shunt is from right to left, and vice versa if systemic is higher than pulmonic. Pulmonic stenosis decreases blood flow to the lungs, which decreases the amount of oxygenated blood returning to the left side of the heart. Because of this lack of oxygenated blood systemically, either palliative shunt surgery to increase pulmonary blood flow or complete repair to close the ventricular septal defect are needed.
All better!
We hope you enjoyed this episode of Where's the Defect, and would like to thank you from the bottom of our heart.